We didn't choose Erie. Erie chose us, and they entrusted in us a great degree of responsibility. There was always a desire to embrace the women of Erie, represent the women of Erie in our clinical trials and our studies. We've achieved phase 1 of our goals. We've identified and built out our laboratory space for the Steve Caritas OSPU, Obstetrical Specimen Procurement Unit. We have built out our Clinical and Translational Research Center. So we're in a great place to hit the ground running. And I'm excited to say we've actually launched 6 different studies that patients are either actively enrolling or in follow-up for in Erie right now.
When we established the McGee at Hamot program, from the very beginning, the one shortcoming was the availability of research in the community. We were sending probably 10 to 15 patients a year down to Pittsburgh to get their care. When you're on a clinical trial, that means many, many trips to Pittsburgh, coordination of care. It was quite a burden on patients. Now that we have the MWRI program at Erie, we can begin to expand that clinical research component that we do so well down at McGee.
Thinking about the community as a whole, when you're engaging persons from a community that's not well represented, you're increasing representation, and that's so important for generalizability. Some of those patients, especially and the further we get out from Erie, it seems, just don't have either computer or internet access. So I'm so excited because we have the CTRC in Erie. And so this is an opportunity now for patients who are eager to get involved in this research and in this work. They're able to come right in, and we're able to hook them up to meeting the neurocognitive team down here in Pittsburgh. So we're still able to centrally do our neurocognitive testing, but reach patients at a further distance.
Erie launching their biobank and database brings the importance of research out into the community. So we're in a conversation with participants to say, here's what we're doing and here's why you're hoping you'll join our efforts. And it gives us a chance to have that conversation. I really see our efforts at enrolling women in our studies as partnering with them to help us find the answers, because without their participation, we wouldn't be able to seek the answers to the questions that are important.
Erie was a natural extension. We've spent a decade building a robust clinical subspecialty practice in women's health care. We are passionate about women's health care. We know when women are healthy, families are healthy, and communities are healthy.